Hello, good evening. I am so sorry about the glitch. I was having network issues. So every time I kept trying to log on, it would trip off and I'll be logged out again. So I create another event and please give me a moment to share. I need to share it with the contacts so that they will be able to access it. Okay, yeah. Okay, I'm almost done with that. Please, if you can see me, kindly send a message. Type a message so that I'll know I'm not alone. Okay, please, if you can see me, type a message so that I'll know I am not alone. Okay, I have three people viewing this video already. But I would really appreciate a comment. Okay, okay. Welcome, Mrs. Bebe. Welcome. Thanks for waiting. The meeting was scheduled for 5:30 p.m. But for the network issues, the network kept logging me out, so I could not continue. All right, now I have shared the link. Kindly share the new link with your loved ones if you would want them to partake in this. Okay, so today we'll be talking about stroke. And I know lots of people are surprised to hear that stroke is not an adult thing, it affects children. So, yes. Thank you, Telia Grace Bature. Thank you for hanging on. I know the network logged me out and I could not, it just kept tripping. And I pray we'll have a stable network throughout this meeting this evening. We won't be taking much of our time today. We'll go straight to the point. This is a series. We'll be having the part 2 next week and the part 3 in 2 weeks' time. So, what is stroke? I know we've been hearing stroke all around. We hear, oh, an adult, an elderly person, an aged person had stroke, someone had stroke, the other person had stroke. And we keep wondering, stroke, stroke, stroke. Sometimes people just think, oh, stroke is a synonym of hypertension. It's not a synonym of hypertension, though persons who have hypertension are likely to have a stroke. So, because hypertension is a risk factor for having a stroke. So, let's talk about stroke. Stroke is a blood vessel disorder. You know, blood vessels, those are the pipes or pipes. Let's call them pipes that carry blood to the brain, to every part of the body. So the blood vessels we are referring to here are the ones that transports blood to the brain. So It's a blood vessel disorder. In a nutshell, it's a blood vessel disorder. So that means the blood vessels carrying blood to the brain have issues. They have problem. So when this happens, it may lead to a stroke. So there are three types of stroke. We have the ischemic stroke, which is very, very, very common. And in ischemic stroke, when we say someone has an ischemic stroke, it's as a result of a blockage. That means the blood vessels transporting blood to the brain, there is a blockage. So when this happens, a person may have a stroke. It may result in a stroke. We also have the hemorrhagic stroke. Hemorrhagic stroke is when there is bleeding, like the vessel transporting blood to the brain gets damaged, like broken or burst. And then as a result of the breakage or burst, the blood, there will now be bleeding in the brain. So this bleeding will now affect the areas affected will now lead to, the bleeding will now lead to a stroke. Then there is also transient ischemic accidents, TIA, transient ischemic accident. Usually it's a mini stroke, like a little stroke, and when this occurs, it will fix itself, like it resolved itself within 24 hours. Like, oh, you see the signs of stroke, but within 24 hours, the person is back on their feet. Usually, when people have TIA, they are encouraged to not just say, oh, I had a stroke and I got healed, thank God. The person should take precaution, the person should be careful and watch their lifestyles and try to prevent another stroke from occurring. So TIA is a mini stroke. So when a person has it, they should not just say, oh, I had a stroke, but within a day I prayed and I am fine now. Yes, prayer works, but if you ever have a stroke that resolved itself within 24 hours, you are in high risk of having another stroke anytime soon or later in life. So it's best to just take precaution to prevent another stroke from occurring later in life, because the one that may occur later in life may be very, very serious, much more than the one had initially. So let's look at the prevalence of stroke. You know, things like stroke are becoming so common nowadays that we almost know people. We know people around us who had stroke or whose loved ones had a stroke at one time or the other. And now let's look at how frequent does stroke happen. Stroke in adults, in adult cases, we have the data we have now. In fact, it says that 1 out of every 4 person, if you have 4 people here now, 1 out of these 4 persons is most likely going to have a stroke in their lifetime. So that's why today, being the World Stroke Day, we are putting out words, we are trying to give orientations, we are trying to talk to people about stroke so that they will know that 1 out of every 4 person is likely to have a stroke in their lifetime. And that one person may be me, it may be you. So if you know that your chances of having a stroke is actually 1/4, then you should work towards preventing that stroke from occurring. So now 1 out of 4 persons will likely have a stroke in their lifetime. What are you doing about it? Don't be that one person. What are you doing to ensure that you won't be that one person? Let's not just pray alone. You pray, you adjust your lifestyle, you exercise, you eat properly, and you reduce the chances of you being that one person out of four people. Then in children, we have for children, okay, still on adults, stroke is the top 10 cause, is one of the top 10 causes of death and disabilities, both in children and in adults. Then in children, one in every 4,000 births, out of 4,000 children giving birth to, one child is most likely going to have issues with, have a stroke during childhood, not when the child grows up. So, and usually children who have stroke, sometimes they have heart conditions, they have sickle cell anemia. These are some of the risk factors that put them in that position that makes them develop or have a stroke during their childhood. So now let's look at the risk factors properly so that we'll know, in case we are one of those who are at risk of having a stroke, we'll quickly adjust our lifestyles. Risk factors in children. I will list the risk factors in children before I list that of adults. Heart disease, like I mentioned earlier. We have problem with the blood vessels supplying the brain. If a child has heart disease, maybe a hole in the heart or any of the other heart diseases, the child is at risk of having a stroke. If a child has problem with the blood vessels supplying the brain with blood, the child is at risk. If a child has sickle cell anemia, the child is at risk. If a child has blood clotting disorder, the child is at risk of having a stroke during childhood. Now let's look at the risk factors for adults. Heart diseases. We have high blood pressure. If you know that you have high blood pressure, you have issues with your blood pressure, and you should know that you're at risk. So work towards reducing, bringing your blood pressure to normal. And you can't do that alone without the help of your doctors. So make sure you take your routine medication, you follow the proper diet that would help your blood pressure. Then also diabetes. People who have diabetes are at risk of having a stroke. Then we have oral contraception. Ladies and women using oral contraception, you are at risk of having a stroke. Yes, I'm telling you the truth. So there are other birth control options. It doesn't have to be oral. It doesn't have to be oral. So if you are taking oral or you know someone using oral contraception, please let them know the risk involved in using oral contraception. Then also we have smoking. If you have the habit of smoking or you are addicted to smoking or dependent on smoking, please work towards breaking that chain, because you are putting yourself at risk of a stroke. Then people with history of transient ischemic accidents, TIA, that I mentioned earlier. That's a type of stroke actually. The one I said resolves itself within 24 hours. Like a person had a stroke, then within 24 hours, they are okay again. So if you have had TIA before, just know that you are at risk. So work towards Make it a major goal in your life to work towards not having a stroke in the rest of your lifetime. Then also we have high blood cholesterol and lipids. If you have high blood cholesterol and lipids, you are at risk of developing a stroke. I mean, having a stroke in your lifetime. Then if you do not exercise, like you always want the easy way out in everything. When it comes to going to even short distances, you would rather drive or ride on a public transport to the place. It's good to have an exercise routine. Exercise, take walks, skip, jump, dance, exercise to reduce having a stroke. So if you do not exercise, please make it a habit to begin to exercise now. Also, obesity. People who are obese are at risk of having a stroke. Then people who are involved in illicit drug usage, unprescribed drugs, hard drugs, what they call hard drugs. People who use them are at risk of having a stroke. Then people who have atrial fibrillation heartbeat, atrial fibrillation, that's irregular heartbeat. You feel it that your heartbeat is not the way it used to be. It's not feeling normal. The palpitation is just different. People who have such issues, atrial fibrillation, are at risk of developing a stroke. Then also hereditary. If you have a family member, your mother, your father, who has any of these health conditions, diabetes, high blood pressure, hypertension, and the likes that I listed already, and you know they have health issues or they've had a stroke before, you may also, if it is hereditary, you may also have a stroke also. So if you have a close family member who has had a stroke, you should start taking precautions so that you also will not have a stroke in the rest of your lifetime. So now, yeah, thank you for your comments. Thanks for joining us. Now let's look at the signs. How do you know when someone is having a stroke? At least it is when you know that someone is having a stroke, that's when you'll be able to help them. How do you know? Now, the signs for children. In children, they'll say, okay, a side or both sides of their body, they'll be feeling kind of weakness, numbness. They'll feel numb and weak. Hello? Please. See, okay, we are back. Sorry, network issues. So, in children, they will feel weakness in one side of their body. They'll have slurred speech or they'll have difficulty with language, like you are speaking with them and they are saying something else, or they do not understand what you are telling them. And you know, this has never been a problem with your child before. So you would know, oh, this might be a stroke. Also, if they have trouble balancing or walking, and suddenly a child is walking with gait or is not balanced, it might be a stroke. And if the child is suddenly feeling drowsy, it might be a stroke. If the child suddenly has seizure, a thing that has never, if your child, like there are children who have seizure disorders, and if your child is not one of such, and suddenly child is having seizure in one or both sides of the body, that is, they are having unusual rhythmic movements of one side of their body or both sides of their bodies. So you know it might be a stroke. And what do you do when you feel, this might be a stroke in this child? You rush to the hospital. If you live in an environment where emergency numbers work well, like you dial the number 112 or whatever works in your environment, if you live in such an environment where such numbers work very well, please call the number and reduce the time between that event and getting to the hospital. And when you get to the hospital, go straight to the emergency department of that hospital. So now let's look at the signs of stroke in an adult. Most times you see that there will be a droop in the face of the person, like suddenly you just see that a person that had a normal face, the alignment of the face was okay before, suddenly the face is drooping, like to one side, tending to one side. Then you should know that this is not normal, it might be a stroke. Then also, if the person, when you see that facial thing, you ask the person to lift both arms. If they cannot lift their arms, it is a sign that it might be a stroke. Then also, when you see that the face is drooping, ask questions, ask them questions, engage them in a conversation to see how they will speak. Is the speech slurred? Like, is it slower than normal? Is the sound not sounding like how they used to sound when they speak before? Then also, you watch out for their ability to comprehend what you are telling them, or what they are, the conversation. Are they following the way they should? So these are signs. And also, the person might be feeling drowsy. The person might have motor issues. That is, the person might lose their balance. Maybe they can't walk well. Then also, the person might faint or lose consciousness for some time. So when these things happen, don't just take any of these signs for granted. Dial the emergency call line, or you take the person to the hospital immediately. Don't think about money. Just rush. Like, I know money, you need money. But the first thing is just think of how to get to the hospital immediately. So now let's look at, okay, we've talked about the signs. Now let's look at prevention. How do we prevent stroke from occurring? In children, I know we have fewer cases of children with stroke, who have stroke, but it doesn't mean we do not have at all. Pregnancy, take precaution. Mothers should take precaution and not take drugs not prescribed to them. Everything we've been discussing so far about preventing disability, preventing speech disorders, such precautions should be taken. Routine checkup during pregnancy should be done, like, be followed judiciously, religiously, to prevent a stroke. To prevent a child, giving birth to a child who has heart diseases or condition that might lead to the child having a stroke eventually. So also, now let's have healthy lifestyles. And these healthy lifestyles, it's not just adults. It's not when you are 40 or you are 50 that you now say, oh, I'm 40, I'm 50 now, I should stop eating this. It should start if you have young children. Choose healthier options of food for them. Cut down on sugar. Let them get used to eating their beverages without sugar. It is how if you have infants, When you are switching, you start complementary feeding. It is whatever you start with that the child will get used to. If you start the child on sugar, the child's taste bud will get used to sugar. If you start the child with sweeteners, the child will get used to that. Like if you make pap or pasta and you add milk, if you start the child on cereals with just milk without any form of sweetener, the child will like it that way. They will get used to it. But if you use sweetener, the child will get used to it. So let's try and adopt healthier options for our children so that as they grow, they get used to choosing healthier options of healthier food items because that's what they've been brought up with. So it won't become an issue that the child is a teenager now and we are trying to work on the child not taking too much sugar or too much fat, too much fried food and all that. Then also, if you look at the list of risk factors for stroke, you will see that maybe you might be defaulting, especially in exercise and lifestyle. You might be, exercise and diet. You might be defaulting in some areas. The time to cut out on your excesses is now, irrespective of your age. Even if you are just, do you know there are young people like in their 20s who have had stroke? It's lifestyle. Sometimes it's lifestyle. Sometimes they may have underlying heart conditions that they do not even know about. So the time to effect a change, to start living right and well is now. And also not just to educate all the people around you. Do you know that if you have a stroke, the people around you, if they are knowledgeable in the risk factors, they are knowledgeable in what they should do, the signs of a stroke, if they know how to spot a stroke immediately, they will know what to do, they will know how to help you. They won't start, maybe an adult faints and the face is drooping, they won't start pouring water and anointing oil on the person. They will know the best thing to do immediately is rush the person to the hospital, and they can be praying on the way to the hospital. That's okay, but not just stay in one place and just pray alone. Prayer and work, prayer and action will give a better result. Yeah. So also, now let me summarize. There's an acronym FAST when it comes to stroke. FAST. Teach everyone around you. Tell them the meaning of FAST. FAST. F stands for face. Look at the person's face. Is it drooping? Is it like the person's face was anatomically aligned, like okay before, then suddenly the person's face is now like, is it drooping? If it is drooping, might be a stroke. Then when you see the face, then you ask the person to lift both arms. Can they lift their arms, or is it just one they can lift and they no longer have control over the other arm? When you see this, you quickly know that this might be a stroke and you know what to do. Then also, the S is for speech. When you see the speech, you see the face drooping and you've asked the person to lift both arms and they do not have control of both arms anymore, or one arm. They have just control over one arm or none. Then you know it might be a stroke. So F for face, A for arms, S for speech. Then you ask them questions. You engage them in a conversation. If what they are saying is not making sense or they are having slurred speech, know that it is a stroke. That will now lead us to T. T is time. T is time. You see, every minute that passes by after a stroke determines the severity of the outcome. If it's going to be death, if it is going to be maybe slight speech disorder or a severe speech disorder, if it is going to be a gait, maybe the person can walk but the person has a gait, or if the person will be totally dependent on a wheelchair. The time between the time between when the stroke took place and when the person gets intervention at the hospital matters a lot. So that is why today is World Stroke Day and we are raising awareness everywhere. Sincerely, it will be a better life if we have less stroke patients and if we have less worst case scenario. It will be a better life if we have less people having to depend on wheelchair because they had stroke. So educate all the people around you. Anyone you see for the rest of today, chat about it, tag Speechy Heaven, post about it on all your social media handles. Because you do not know if you will be at the mercy of someone reading whatever you are posting today, the fast. You do not know if you will be at their mercy tomorrow. So that maybe if you develop a stroke and someone is around you, they will know what to do immediately. They will not waste time. Please educate if you have elderly parents, educate them, educate their caregivers, educate if you have people, loved ones who are diabetic, educate them. You have people with high blood pressure, educate them. People who are hypertensive, educate them. Educate not just them, but everyone around them. Time is precious. Time is precious. You see, the first hour of the stroke, if the person gets intervention, the after effect, the outcome will be minimized. You can't compare that with 10 hours after, 3 hours after, a day after, before intervention. Please act fast and reduce pre-hospital delay. What I mean by pre-hospital delay, reduce the time in between reduce the occurrence, shorten the time, close that gap between the stroke occurrence and the time the person gets to the hospital. My prayer is that none of us will have stroke. But then, remember, it's not just by prayer. Do the work. Do the work by living right, adopting a healthy lifestyle, working on your diet, exercising, being active, and living a positive life. So next week, we'll be talking about aphasia. Aphasia is one of the speech disorders that comes with a stroke. Yes, many people who have a stroke are likely to develop one or two speech or language disorders. So next week, we'll talk about aphasia. And in the subsequent videos, we'll talk about tips. I will be giving us tips of how to support people who have stroke around us. Thank you very much. Remember to spread the word. Remember to use hashtag World Stroke Day, hashtag Precious Time, hashtag Speechy Heaven. See you next week. Bye. And yes, thank you for coming. Thank you, everyone. Temiolaya, Oloyedeni, Abiola Suliyat, Fagbemi Abimbola, Enilsil, Buchanan Fort, Obalola, Lara Bebei, Tenia Grace Bature, and everyone else who will be watching this video later. Thank you. Bye.